want to talk about exercise prescription in ALS. So the underlying construct is that moderate exercise, meaning around 50 to 75-ish% heart rate max, is recommended in the early stages. Okay, you're not going to give moderate exercise to stage 4 when they're really deconditioned and weak. Okay, exercise helps with neuronal plasticity, and it mediates some of those trophic factors like BDNF, okay, and glial-derived neurotrophin factor. Exercise creates dendritic structuring, okay, increases neurotransmitter release in the motor plate. So you really want to get that neurotransmitter concentrated in the motor plate when there's exchange of neurotransmitters, okay? Enhances protein synthesis, strengthens the synapse connections, and helps just maintaining that firing potential, okay? So don't be afraid of prescribing exercise. They should avoid overload of the nervous system and muscle system and respiratory system. So don't overload them with exercise, heavy exercise. Don't do that, okay? Be light, be cautious with these patients, okay? And just know that moderate intensity does not lengthen their survival, but it causes the slowdown of loss of strength, endurance, and so they won't fatigue as quickly, and prevents contractures. Again, high intensity might damage the mitochondria. You don't want to prescribe high intensity exercise for people with ALS, okay? It also increases oxidative stress and increases extracellular edema. So don't do that. I cannot stress that enough, okay? But again, moderate exercise, okay. Early stage, 1, 2, 3, 4, 5, no, okay. 4, 5, even 3, you might just do range of motion, okay? Now, these patients might start also with poor posture because their postural muscles might start with fatigue. So, posture, keep in mind, posture will be very important for chest expansion when they're breathing. So prescribe those exercises for posture. Okay, my patient came to me with concerns of his posture. And he was telling me, Lily, I'm noticing that my posture is just not right because, I'm weak. So his concern was his posture. So, we need to address that as well and assess that as well, okay? So last thing, other recommendations, work closely with a multidisciplinary team or clinic, and be familiar with the disease process of ALS, which I already described. Use objective measures as MMT or a dynamometer if you do have one to kind of just know the progression of the disease and just have something to prove it and document about it so you can be aware of the stages. Really concentrate the exercise in the early stages when they're able to do them, when they have sufficient strength, respiratory function, and endurance, okay? Something that I've learned, and I will see if I can get the citation, is don't prescribe eccentric exercises. So because they have more impact in the muscle, and when I do eccentric, I get very sore, okay? So you don't want to cause soreness to these patients, okay? And strengthen only the anti-gravity muscles, meaning muscles that are more than 3 out of 5. Exercise, approach with caution with later stages of ALS. Again, no high intensity, okay? And last thing that I wanted to end with is the signs of muscle overuse. So when will you know that you maybe push it too hard and you should be cautious next time? Recognizing the signs of overuse is very important in these patients and also in patients like Guillain-Barré, okay? So delayed onset muscle soreness usually peaks 1 to 5 days after the training, okay? Maybe there's a reduction in maximal force that gradually recovers you know, a couple of days later, I was very like weak, but then now I'm back to, you know, my usual. That was maybe you overloaded the system. Severe muscle cramping after exercise. Okay, you don't want to make them sore. Feeling of heaviness in the extremities, increased fasciculations. Ooh, no, we don't want that. And prolonged shortness of breath. So those are the signs of muscle overuse that you should know for after you work with patients with ALS, okay? So I believe this is part 2 of our talk because this video was quite long, but I believe it was, you know, quite informative for you so you know how to approach and where to start, how to approach your examination, your evaluation. My advice to you if you have a patient with ALS is hear them, you know, hear what they have to say, hear their concerns, open up your eyes and your mind, and not just be very like impairment focused. Here again, there needs to be a switch of priorities. You're not going to treat to improve. You're going to treat to maintain and assist. Okay. Goals will be different. Okay, goals will be more like, and you know, education will perform exercise independently, etc., etc. You want to, in the early stages, you want to prevent fear of movement, prevent fear of falling, improve, you know, their functional capacity in the early stages, prevent inactivity. Okay, and as they progress, you know, you really want to switch your priorities and help them through the progression of the disease. Again, exercise will not stop the progression of the disease, but will help with pain, contractures, fatigue, you know, slow down the rate of weakness of the muscles, okay? So again, I really hope this was helpful, and I will see you next time.